country's health minister says the deployment of a second Ebola vaccine in the current outbreak won't be a solution to rolling back the disease unless it's matched with the scale-up of other interventions. CGTN's Ocamringa has more.
International health experts and their Congolese counterparts have gathered in Kinshasa to discuss the introduction of a second Ebola vaccine. The current one being used in the outbreak is produced by U.S. pharmaceutical company Merck. It's proved effective in controlling the spread of the disease, but is reported to be in limited supply. And so manufacturers from Russia, the U.S. and China attended the meeting to make presentations about the efficacy of their vaccines.
Had those vaccines tested in China, also in West Africa, with hundreds of subjects, and it demonstrated very safe and very immunogenic.
A World Health Organization advisory group had earlier recommended a vaccine made by U.S. firm Johnson & Johnson.
The vaccine is safe to be used, specifically also for use in pregnant women, and that based on the immune responses we see, it's very likely to be also very protective. So based on that, I feel we are a good candidate, but again, we will have to see on what the final decisions are.
More than 100,000 people who've come into contact with Ebola patients in North Kivu and Ituri provinces have been vaccinated since the onset of the outbreak last August. But attacks on health workers by armed groups have hampered the containment of the outbreak. The DRC's health minister says the new vaccine wouldn't be a cure-all, considering the other drawbacks.
But if you want to control and to stop this outbreak, it's very important to keep in mind that other pillars like surveillance, contact tracing, IPC, infection prevention and control, safe burial, all these pillars are very important, and it's all these pillars that have helped us to contain this outbreak. So the vaccination is a big component, but we must not think that vaccine is the solution to this outbreak.
The Ebola response was temporarily interrupted in the eastern town of Beni following 2 days of insecurity. More than 1,500 people have died of Ebola since August last year. This two-day meeting was meant to share the latest scientific information about the experimental Ebola vaccines that have been produced. The Congolese government will now meet with health experts and make the final decision about whether to introduce another vaccine. Ocamringa, CGTN, Kinshasa, Democratic Republic of Congo.